Gynecologic oncology is primarily the evaluation and management of women that either have been diagnosed with gynecologic cancers, those being cancers of the female reproductive tract, or women that are felt to potentially have neoplasm of one of those organ systems. So I either will be treating women that have already been diagnosed with these cancers or that are being referred to me to see if in fact they do have them. Nationally, endometrial cancer is the most common of all of the gynecologic cancers. There are approximately 60,000 women that are diagnosed with endometrial cancer every year in the United States, and roughly 10,000 women die from endometrial cancer. One of the mechanisms by which endometrial cancers develop has to do with body weight. And the more body weight a woman carries, the more estrogen that her body produces. And the estrogen is what stimulates the transformation of a normal endometrial lining into a malignant endometrial lining. So as the country is becoming increasingly heavier, as with each passing year, the incidence of endometrial cancer has become higher and higher and higher each year. So interestingly, though it is the most common of all the gynecologic cancers, it is also the most curable of all the gynecologic cancers. Ovarian cancer is the second most common gynecologic cancer that we manage. Unlike endometrial cancer, ovarian cancer is a highly lethal malignancy. It is the most lethal of all of the gynecologic cancers, and in fact accounts for more deaths each year than all the other gynecologic cancers combined. Roughly 22,000 women are diagnosed each year in the United States, and about 14,000 to 16,000 women die each year from ovarian cancer. Cervical cancer is not a common cancer in the United States or in other industrialized countries of the world that perform pap smear screening. Cervical cancer is a very common cancer worldwide because 80% of all cases of cervical cancer that are diagnosed throughout the world are diagnosed in developing countries of the world that do not screen with pap smears. I mean, it actually accounts for roughly 250,000 deaths in women every year worldwide in the roughly 500 or so thousand cases of cervical cancer that are diagnosed each year worldwide. But in the United States last year, approximately 10,000 women were diagnosed with cervical cancer as compared to the 500,000 diagnosed worldwide. And last year in the United States, roughly 3,500 women died from cervical cancer as compared to the 250,000 women that died worldwide. So we're blessed to have the ability to screen patients in the United States with pap smears. So I'm very proud of our practice here because we really go out of our way to stay current, up to date, and offer the most cutting-edge therapies that we can to allow our patients to have the best chance they can have to be cured.